Welcome to As a Woman, Fertility Hormones and Beyond. I'm your host, Dr. Natalie Crawford, and I am a board-certified OBGYN and fertility physician, and also co-founder of Fora Fertility in Austin, Texas. Each week on this podcast, I discuss health and fertility and how they relate to your true self. Become a part of the community of collaboration that amplifies others as a woman. I hope you enjoy the episode. Welcome to the As a Woman podcast. I'm your host, Dr. Natalie Crawford, and today we are talking all about my top tips for you to start trying to get pregnant, or if you're trying right now. One thing that I think is just so interesting is this approach that society has generally accepted when it comes to your fertility, which is spend half your reproductive life preventing birth control pills, condoms, avoid, and then suddenly you're going to wake up ready one day and the idea is just pull the goalie and try. There's often not a real game plan about what are we going to do, or what do we need to do to help this happen in the best way, or what are the warning signs something is wrong. Also, what's interesting is that if you contrast that to pregnancy itself, there's an abundance of talk about what you should and shouldn't do when you're pregnant, how to have the healthiest pregnancy, and generally how to prepare for that pregnancy. And so how to prepare for your fertility journey is really mostly about being educated and understanding your body, which sadly is something that just so many of us don't do. And it's no fault of our own. It's just based on the world around us and what we have been taught about our body and what we have been told, often by healthcare providers, about the world around us and how that impacts our ability to get pregnant. So today we're going to be diving into my top tips, things I wish everybody would know or think about when they were starting their fertility journey. Anytime I give a talk on this or go on a podcast or whatever, people are going to come and say, yeah, but my friend did X and had no problem, or my friend did Y and it was fine. And yes, you're going to have one-off cases where there's absolutely no problem, but it's a different approach. Tons of people will smoke cigarettes and never get cancer. However, smoking cigarettes increases the rate of cancer. If we look at your fertility as number one, a goal, we want to plan and prepare for that goal. Everybody here knows how I feel about goals. But two, ultimately a sign of your overall health, and that's actually true and proven. Having infertility puts you at higher risk for certain other health conditions later in life. And I think a lot of it is what is the common thread tying these things together. And some of it is actually lifestyle factors. So we're going to cut to the chase and go through a lot of that today, in addition to some cycle tracking basics. Before we do, a few housekeeping announcements. Number one, we have just launched our new Natalie's Trying to Conceive freebie. This is my starter kit. And a lot of this information we'll go over today, but you can have a downloadable version of it. And I think that's just so nice to look back on or to be able to remember, because it's sometimes hard to remember all of this. You can get the downloadable freebie by signing up for the newsletter. You can go to the website at nataliecrawfordmd.com/newsletter and sign right up. Or if you just go to nataliecrawfordmd.com, you'll see where you can click and fill out your information, and then we'll send it right to your inbox. If you are already a newsletter subscriber, don't worry, you will be getting a special edition sent right to you. As many of you know, I introduced the book deal for my new book called Balancing Act, which is all about learning about your body and optimizing your fertility and understanding and improving your fertility journey. I have put in so much blood, sweat, and tears into this project and fought for it, and I'm so excited that the world also sees its need as well. So as we gear up for the publication, I promise you'll know when it's on pre-sale and all the extra goodies that will come with it initially. But we're going to be doing a lot of really special things through the newsletter in the interim. So this is a great time to sign up. Right now, the newsletter answers fertility questions, gives you updates on a variety of things. I talk about fertility in the news, and really just a nice way to connect with the community. We're starting to do a special Q&A and myth busting and some extra fun newsletter subscriber only things. So go ahead and subscribe. Also, every episode we do Q&A. So fertility Q&A can be asked on Instagram at nataliecrawfordmd every Monday. Some of the questions will be answered right there on Instagram. Some will be answered here at the end of the podcast, and some will be answered in the newsletter. The other way to ask questions is to go to the voicemail. So some of my favorite episodes are the As a Woman voicemail episodes where you call, leave questions, and we answer. That voicemail number is 657-229-3672. Again, that is 657-229-3672. Call, leave a question. You don't have to leave your name. All the questions are amazing. We are going to be increasing the number of those episodes very soon because we've been getting the best questions. All right, well, let's dive in and talk about what I recommend if you are trying to get pregnant. Whenever I like to think about getting pregnant, I want to divide this into 3 sections. Number 1, coming off contraception if you are on it. Number 2, understanding your cycle and warning signs and tracking. And number 3, lifestyle and optimization. So let's start with coming off of contraception if you are on. So there's a variety of different types of contraception. You have IUDs, which can be progesterone-based or copper. You have different types of progesterone-only contraception, IUD being one, but you also can have an implant in your arm. You can have the Depo-Provera shot. You also then have some combined estrogen-progesterone contraception, most notably known as the birth control pill. So let's just go through them, starting at the birth control pill. The birth control pill is a combination of ethinyl estradiol and a type of progestin. These are synthetic hormones that are telling the brain not to send out any FSH and LH. In order to understand how the pill works, we have to think about how the cycle works. So just remember my simplest way. Every single month, you have a group of eggs that is sent out of that vault in the ovary. So all your eggs are stored in a vault. One single month, you have a group of them coming out, and each egg grows inside a follicle. The eggs are microscopic, and you can see a follicle on ultrasound. So very often we can do a follicle count or a follicle measurement to figure out where you are in your cycle or how many eggs you have remaining. At the start of the cycle, when you're on your period, your brain is going to send out FSH, and FSH is follicle stimulating hormone. FSH is super well named, and it's going to get a follicle to grow. As that follicle grows, it is going to make estrogen, and that estrogen is going to get the uterine lining ready for implantation. It's also going to make you feel pretty good. This is the follicular phase where you have more energy, a great time to achieve goals, exercise, and it's when your sex drive increases. When your estrogen is at a peak level, this is the level typically of around 200 picograms for 50 hours, so it's quite specific. That is going to be the signal to your brain that you have a mature egg, and that's going to allow the brain to then send out a surge of LH. This LH is luteinizing hormone, and the first time your body sees it in a surge, this will actually cause the follicle to rupture. The cyst, which is the follicle ruptures, allows the egg outside of it, and then the cyst reforms and becomes what is known as the corpus luteum. The corpus luteum now is going to make progesterone at pulses throughout the entire luteal phase, stimulated by LH pulses from the brain. So this is now your luteal phase, and progesterone is the progestational hormone, and it does very specific things. It typically slows you down, it makes you conserve energy a little bit, you might be hungrier, it wants you to stay inside and gestate a baby and be safe. So that's what progesterone does. When you're not pregnant, that corpus luteum can only live for about 12 to 14 days, so it will die, progesterone will drop, and then suddenly you'll get a period and the cycle is starting over. So what's so fascinating is one thing is happening in our uterus, the growing of lining with estrogen, the stabilizing of the lining with progesterone, and then the withdrawal bleed when progesterone drops. And a different cycle is happening in the ovaries, which is the growing of an egg to make estrogen, the rupture of that follicle, which is ovulation, reformation of that follicle to become the corpus luteum, and then resolution of the corpus luteum and a new group of eggs coming out of the vault. So when you take birth control pills, if you are taking estrogen, that's telling the brain, we must already have an egg growing. The brain can't differentiate. And so it's not going to send out FSH. And when you're not going to send out FSH, you're not going to grow an egg to ovulate. So it's very effective contraception if taken daily. However, when you take the birth control pill, one thing that's really important to know is that there's different ways we take it now. So the original way was you would take it for 3 weeks or 21 days, and then you would take 7 days of placebo pills or 7 days off. That was supposedly to mimic a natural cycle. Well, now we see a shorter interval of the placebo or sugar pills, or we just don't even have to take those, just take no pills. Or we see people stacking packs together, which is perfectly safe and fine to have fewer periods. So if you're having fewer periods, that's completely fine. You don't even have to have a period. You can take continuous birth control all the time. None of that is harmful for your body. Now, birth control has some side effects, and that's a whole different discussion. It does have certain risks if you smoke, if you have risk of blood clots. It does carry certain risks if you have migraines. They do change your clotting factors, some of your vitamins. Some people feel great on them, some people don't. If you're using it for contraception is the point of this discussion. If you're taking it monthly and you have a monthly bleed, you really don't have to stop it very far in advance, although I typically recommend stopping it 3 months in advance so that you can see if your ovulatory pattern comes back. That bleed that you see every month is not a real bleed. That is just a withdrawal from not being on the progesterone. So we need to remove that suppression on the brain and see if our ovaries can wake up. If you've been taking the pills or you've been stacking them, so you've been not having a period at all or having a period every 3 months, I now recommend that you stop the pill for at least 6 months before you want to get pregnant. This means you're going to have to transition over to condoms or another effective method. But the reason why is that, one, it might take longer to restore that ovulatory pattern to get the suppression off, but also from prolonged pills, you can see a suppressive effect on the growth of the endometrial lining. When your uterus has seen progesterone for that long, especially if your periods have gotten very light or absent, then it's important to give your uterus a time to see some estrogen in some months before you're trying to get pregnant. When it comes to other types of birth control, we have to talk about IUDs. So IUDs are intrauterine devices. These can either be a copper or a progesterone base. So a copper IUD actually causes inflammation inside the uterus, which does not impact the ovulatory cycle or your hormones at all. In fact, it makes your period heavier, if anything. Therefore, if you are stopping the copper IUD, getting it removed, you can get pregnant immediately afterward. It's one of the advantages. A progesterone IUD, the longer you have had it in place, and specifically if you got to amenorrhea or no periods when you had it, that is going to be a circumstance where now you need to remove it before you want to get pregnant, obviously, but with some time to allow that lining to recover. Again, similar to continuous use birth control pills, this is a daily progesterone exposure. So the longer your body's seen progesterone only, which it normally would just see for half the cycle, it is just thinning out that lining, and this can lead to an improvement in your periods, less bleeding, no periods, and those things can be great when you don't want to be pregnant, but it can take many months for that uterus to get back in check. So one, we need to remove the IUD. I usually say 6 months before you want to get pregnant if it's a progesterone IUD. This will give the lining some time to rebuild. And then once it rebuilds, you'll be able to see yourself bleed and know if everything is functioning appropriately. And if you don't have bleeds, regular bleeds by the end of this, then you need to go get an evaluation. Very important to note that the Depo-Provera shot, which is the injectable birth control pill, it's not used nearly as much anymore, but here and there I'll still see a patient who is on this. It is proven to prevent ovulation for 3 months. So you have to go get a shot every 3 months if you're using it for contraception. However, it actually can prevent ovulation for up to 18 months. So this is a method you would need to stop 2 years before you want to get pregnant. Otherwise, it can live in your system and prevent you from ovulating for a long time. Regardless of if you are on birth control or not, when it's time to get pregnant, tracking your cycles and understanding your periods is really, really important. We can go into nitty-gritty details about cycle tracking, and that is not what this is about today. Today is about the very basics, just so that you have some idea of your cycles. You would be shocked at how many people have an appointment with me, show up, and when I ask if their period is regular or not, they really have no clue. I mean, they know it comes, but they haven't been tracking how many days apart it is, and they don't have a concept of when they ovulate within their cycle. So, number one, having a regular, predictable period is normal, and it is a sign that your hormones are working well. That period should be within 1 to 2 days of itself every month. So that doesn't mean it always has to be the same number day of the month, but it does mean from day 1 to day 1, I would expect around the same number of days. So if your period is 30 days apart from May to June, I would expect it to be within that by 1 or 2 the next month. Overall, you will see people say that links between 25 to 35 days are all normal, and that is true. Some people have a shorter interval and some people have a longer interval, but it shouldn't hop around. So you shouldn't have a 25-day month and then a 36-day. So if your period is humping around like that, then that's just a sign it shouldn't jump that much and that it's irregularly regular. If you have irregular cycles, it can be really hard to get pregnant, but there could be something wrong that could be preventing you. So I want you to go see your OBGYN or fertility doctor. You need to get your thyroid checked, a prolactin checked. You should get an egg count checked. And that's kind of the minimum of where you should at least start. There's some other ends of that spectrum. The typical workup for an irregular cycle is an FSH, estrogen, TSH, which is thyroid, and a prolactin, and then anatomical as well. So that kind of pulls your egg count in there. Now, if you have no periods at all, that's not normal. Unless you are on some type of contraception that's preventing them, it's not normal and it's not good. Your body really needs estrogen. Estrogen is the hormone du jour of the female body. And so if you are not having periods or they're extremely sporadic, please go see a doctor. And you might need to consider getting on estrogen replacement or ovulation induction medication, obviously, if you want to be pregnant. So yes, if your cycles are irregular, you can be placed on medication to help you ovulate. And these medications work by telling your brain to send out more of the FSH. So like we talked about earlier, FSH is what gets a follicle to grow. Medications like Clomid and Letrozole can help with irregular cycles by telling your brain to send out more FSH. If you have regular cycles or irregularly regular, you might be able to track them. So for regular cycles, you have more tracking options than irregular. If they're regular, some of your options can include, number one, easiest is calendar method. Calendar method is taking the assumption that you have a normal luteal phase, which will be 12 to 14 days in length. You then take your cycle length and subtract 14. So for example, if your cycle is 30 days long, you would subtract out 14 and you would get cycle day 16 as your expected ovulation day. Your fertile window isn't going to be the 5 days before this, ending on this day of ovulation. And this is because sperm live in the female reproductive tract for up to 5 days. The egg, after it has been ovulated, only lives for approximately 24 hours. So you really want to get the sperm there before or during that egg release. The goal is to have intercourse in this time zone. So in this example, days 10 to 16 would be your target days. So you could have sex all of those days, or you could have sex every other day, or you could simply have sex 3 times a week and you're hitting it without having to track this at all. If you have regular cycles, you are ovulating. Nobody should ever have less sex. So if you and your partner routinely have intercourse every day, 3 to 4 times a week, you don't need to track, at least not to start, because you're ovulating and you're putting sperm there. Tracking is helpful if you are like the majority of people who do not have everyday intercourse, trying to target putting sperm there. There is no need to try to have less sex when you're getting pregnant. So sex every day has always been shown to be fine and potentially advantageous when you're trying to get pregnant because sperm is made daily and the egg is so short-lived. But again, calendar method is only going to work if your cycles are very regular. Now, another option for regular cycles include basal body temperature. Basal body temperature is where you are recording your temperature every day immediately upon waking up. For BBT, your temperature has to be recorded the same time every day, and this will vary if you're sick or you had a fever or you're drinking alcohol the night before, if you're changing the time you're waking or the room temperature. So it's very, very picky, in my opinion. You just be very particular about it. But you need 1/10 degree thermometer or specific device for BBT, and you're looking for a 1/2 to a 1 degree increase in temperature to confirm you ovulated, which typically happens 2 to 3 days after ovulation. It's best to confirm that you did in fact ovulate because by the time you get the positive, it's too late to go and change anything now, meaning at this point, you already ovulated. If you didn't have sex, the egg is already passed through the road. But if you're concerned about how long your luteal phase is, or if you did in fact ovulate, or potentially just wanting to confirm, then I think that's a great option. Some people who are trying have intercourse until their BBT rises and then they stop. So that's another approach. An ovulation predictor kit is my personal favorite if you're trying to get pregnant. These are a daily urinary test. It looks very much like a pregnancy test. You are going to look for the first positive. Once you get a positive, you're not going to keep testing. One of the most common questions I get is, oh, but I got another positive later in my cycle. That's fine because LH pulses on and off the whole luteal phase. So we're looking for that first positive. The best time to take an OPK is going to be 1 time per day, sometime between 10 a.m. to 2 p.m. And the OPK is checking the LH surge. Remember, the LH surge is what your brain is sending out in order to trigger ovulation. So the day you get the positive OPK is not actually your ovulation day, but it is the day before. So if you were going to target 2 days with intercourse on these, it would be that day of the positive OPK and the next day. And then another option is going to be cervical mucus. So cervical mucus starts to increase about 5 to 6 days before you ovulate. As your estrogen is rising, the cervical mucus is going to change. But you're getting that type 4 cervical mucus with that peak estrogen. And so that is considered ovulation day. And that will be when you want to target intercourse, when you're able to reach inside, pull out cervical mucus, stretch it between your fingers, and really see that sticky, stretchy, egg white-like substance. So for all of these, I think the greatest take home is that It's important to have intercourse to get pregnant, and all of these tracking methods are truly trying to help you time intercourse the best. If you're having regular cycles, you're ovulating. There is the first stage of ovulatory dysfunction, which can be some luteal phase issues, either a shorter luteal phase or spotting before your period starts. More than just a day or two of spotting is actually abnormal. And this is, as I said, the first stage of ovulatory dysfunction. So knowing the day you ovulate and then knowing the day your period starts can be a clue that potentially you are having some cycle dysfunction if you are struggling to get pregnant. So even if you don't want to start with all of these tracking, or maybe you just start with the calendar method, it's important that you can potentially add some of these other ones in if you are not getting pregnant immediately. All right, and then I always get asked about lifestyle factors and what you can do, and I'm a huge fan for controlling what you can control. So these are going to be really quickly my top lifestyle tips if you're trying to get pregnant and how to put yourself in the best position. Before I go over them, I do want to say that if you're under age 35, definition of infertility is trying to get pregnant for 1 year and not having success. However, 80% of people will be pregnant at 6 months, so you absolutely can get an evaluation sooner if you've been timing intercourse for 6 months and are not pregnant. At age 35 and older, we don't like you to try for longer than 6 months without getting a fertility evaluation, ultimately because you have a higher probability that something could be wrong and because time is more of the essence when it comes to egg quality and egg count. So if you've been trying for over a year, you definitely need to go get an evaluation. Some things lifestyle cannot overcome. I'm a fertility doctor and I do IVF every single day. Yet I help a lot of patients get pregnant without IVF. But sometimes these recommendations aid you even if you're in the cycle. So even if you're somebody who has to do fertility treatments to get pregnant, that's no failure on your part, but it is your responsibility to at least understand your body and try to decrease the odds of some external variable having a negative outcome. So with that being said, here are Natalie's best lifestyle recommendations. So number one, let's start with my favorite, sleep. You really need to sleep 7 to 9 hours a night. I really love it to be 7.5 or 8 at a minimum. I want you to set a good sleeping environment. So whatever that means, probably means putting your phone not next to your bed. When it comes to exercise, I always say it's best to pay attention to your cycle. This is where I love cycle syncing because it just makes sense. In your follicular phase, so that time period of your cycle, the first half where you're growing a follicle, the time from having a period to ovulation, your estrogen is its highest and your progesterone is low. This is estrogen dominant and it's normal. This is when that estrogen is working overtime. You have high energy, so take advantage of it. This is high intensity workouts, increased demand training, set new PRs, go for the longer runs, lean into using your energy to better your body. But in the luteal phase, this is the rest and nourish phase. This is after ovulation where that corpus luteum is making progesterone. So your progestational hormone wants to gestate a baby. Whether you're pregnant or not, that's what it's meant to do, rest and relax. So lean in more to take it easy. Go for walks, decrease the vigorous activity, try yoga, try weight training, a little lesser intensity. This is a time to kind of allow your body to do what it wants and conserve some of that energy. And then to everybody, I say, set 30 minutes a day for you. This is the best advice I have for stress. Find something that makes you feel better. And this is personal. What works for me is not going to work for you. Maybe it's acupuncture, meditation, journaling, walks outside, yoga. I don't know. You're different than me. But set some time just for you without your phone where you can have that feeling afterwards. That is going to help us get our hormones in balance, have our cortisol be the lowest. And the point of having these moments of cortisol lowering is so that our brain is not listening to all the static noise. It can really hear the hormonal signals from our ovaries. All right, everybody's favorite is going to be toxins. No smoking, vaping, marijuana, and you really should not drink alcohol. It is a type 1 carcinogen and it is inflammatory. There's no question. If you're a drinker, limit it. Should absolutely not be every day. It should be an occasion. Caffeine, you can have up to 200 milligrams a day or less. 1 shot of espresso is 75, so choose wisely when you're choosing your drinks. Buy local and organic produce. Wash it really well. Eat fewer processed foods and fast foods. They have a huge amount of environmental toxins in addition to just not being good for you at all. Limit going out to eat. Like, don't order DoorDash every night. Maybe cook some meals. That's going to help you eat better from a meal standpoint, but also going to help you be exposed to less things and be in more control of what you're consuming. And then look in your kitchen and your glassware. Avoid the Teflon and the nonstick cookware. It has PFCs, or what we call forever chemicals, in them. Avoid heating any plastics like the microwave or the dishwasher. Think about your coffee maker. Do you have a plastic carafe? Get one that's glass. And use glass or stainless drink containers, not plastic ones. As a general rule, I usually say any strong chemicals are not going to be great. So whether that's detergent, paint, varnishes, air fresheners, candles, nothing strongly scented is going to be great. Pesticides, you're going to want to try to avoid in your yard, or make sure you wash your hands and you wash your clothes if you go outside. And an interesting one is the thermal paper. So this used to be mostly from receipts. The grocery store would hand you a receipt. That thermal paper has a lot of toxins in it, actually. But another one that people don't think about is the airport. So if you check your bag and you print your airline ticket, it is toxic. So just use your phone. All right, and then I'm going to give you my version of the fertility diet. The fertility diet is not anything that is hugely shocking. The truth is that you should eat more fruits, vegetables, whole grains, and you should eat less processed foods and sugar. I don't think that's surprising to everybody, but there's so many different nuances, and I don't like to set just a one-time diet plan for everybody, and I don't like to prescribe the way I eat for everybody. So this is what I tell my patients, because I feel like this is a very doable way that forces you in to a variety of nutritious foods and an increase in fruits and vegetables. So fruits and vegetables are going to be the highlight of your diet. You're going to have meatless Monday, so no meat on Monday. And then the other days of the week, you're only going to have meat 1 serving a day. And I don't count eggs as meat in this discussion. The reason we do this is that if you're not having chicken for dinner, you're going to have to have something else. You're going to automatically increase your vegetables, and you're going to increase other sources of protein like your lentils, your beans, your tofu. So you're going to have to explore some new foods if you haven't been eating them. And those foods have an excellent nutritious value. Side note is, if you don't eat meat, you don't have to eat meat. There's no evidence that meat is helpful for your fertility. Red meat is actually the worst, so I recommend 0 to 1 serving of red meat a week. If you're a red meat person, pick the day of the week that's special to you, and that's where you're going to have your red meat. Fish is an excellent meat source if you like meat, but less than 3 times a week, or 3 times at most, because it can be a high source of mercury. Soy is good. Tofu's great. Edamame is great. Your healthy fats are really great. Your avocados, your olive oils, your nuts. Whole grain carbs are a great source of fiber, which can really help us with insulin resistance. And I want you to have a daily prenatal vitamin with at least 400 micrograms of folic acid. I want it to have omega-3 fatty acids, which is that DHA and EPA, good for baby's brain, and vitamin D. I want you to limit processed sugar, refined carbs. That doesn't mean you can never have cake on your birthday, but it means you should have cake on your birthday and not the other days. Also, dairy and gluten are 2 I get asked about all the time. If you have celiac, you should avoid gluten. If you have other autoimmune disease, you should trial no gluten for 30 days and see if when you add it back in, you feel bad. And if you do, you're having an inflammatory response. If you have unexplained infertility, you should avoid gluten for 30 days. Add it back in. And if you do and you have an inflammatory response, you should avoid it again. Dairy is mostly fine unless you notice symptoms. If you get gassy or bloated when you have dairy, that's your body having internal inflammation. So then don't eat it. And if you're unsure, do the removal again. Take away dairy and gluten both for 30 days. Add one of them back in for a week. See how you feel. Decide. Then try the other one. If you do eat dairy, though, I want you to have full fat dairy. I don't like the low fat, the skim. Those are just highly processed. So if you're going to have it, go for it. My general approach to food, if you're trying to get pregnant, is 1, if you have infertility and you're going through treatment, I want you to have the lowest level of inflammation to have the highest chance of success you can. If you don't have infertility, I'd love for you not to get it. And controlling the world around you is one piece of the puzzle. Nothing is all or none. And yes, people who eat McDonald's every day get pregnant, and people who smoke cigarettes get pregnant, but we're trying to make you have the best journey, have the lowest chance of infertility, be your healthiest self, and have a healthy baby. So what you're choosing to do is helpful for you regardless of what other people may choose to do. So treat yourself kindly on the majority of days so that you can indulge in those little moments and your body can handle that temporary inflammation without it being something else adding into the mix. I'm now going to answer some of your fertility questions, and this is For Fertility's Sake, our weekly Q&A. These questions you can go and ask on Instagram at nataliecrawfordmd every Monday. Some will be answered on Instagram, some will be answered here on the podcast, and some will be answered in the newsletter, nataliecrawfordmd.com/newsletter. What to do if you have low estrogen? Well, that's a really interesting question. I think it depends on what the source of that low estrogen may be and why do you say that you have it. If you're ovulating, you don't have low estrogen. You might at certain times in the cycle because that's super normal. Your estrogen will be lower for the first week, and then when a follicle starts growing, it'll rise, it'll peak around ovulation, and then it will dip a little but still be elevated throughout the luteal phase, and then it will drop about a week before or as you're starting to enter into having that next period as that corpus luteum dies. So when you check is what's going to determine the most. Number one, I see that people just had it drawn on the wrong day. That said, if you're not having a period, you absolutely can have low estrogen, or if your cycles are very irregular. And young women need estrogen. This is something that's going to help your body function the best. And I wish I could scream it from the rooftops because I see so many people estrogen deficient and it's impacting their quality of life, their brain, their memory, their concentration, their sex drive, their health. It's so impactful. So you should get on estrogen. One, try to figure out the cause. And if it's hypothalamics, meaning your brain's not allowing you to make estrogen, or you're in ovarian failure and you can't make estrogen, then you need estrogen. Trying to conceive while breastfeeding, I have a whole YouTube video on this. It is a lot harder. If you have your period back, it's going to be near impossible. I say near impossible because everybody ovulates at some point before their next period comes. But if your periods are back, having prolactin around will thin out the lining, which does make it harder, and it can give some luteal phase insufficiency. High prolactin is the number one cause of having a luteal phase defect or a short luteal phase. So I do worry about that impact on you trying to get pregnant. However, I never want somebody to compromise the experience with a baby. And do people get pregnant when breastfeeding? All the time. If your period's back when you're breastfeeding, it is not contraception, so you need to prevent pregnancy in some other way. All right, and our last question is, can implantation bleeding have clots? It absolutely can, but it's not common. Most implantation bleeding is going to be darker or light pink. It's going to be very light, more like spotting, and less than a period. Now, you could have clotting bleeding. Remember, clots can form just because blood was sitting up higher in your body, and then we saw it when it came out your vagina. And specifically, if you have more of like a subchorionic, so not quite implantation bleeding, but that placental bleed, that could play a role. But if you're having bleeding, I recommend you go get an evaluation. If you have a positive pregnancy test and you're bleeding, that was my first sign that actually I had an ectopic pregnancy. So bleeding when pregnant equals evaluation by your doctor. So sending you all the love and hope everything works out. Hope you guys enjoyed this episode. I've always enjoyed you. So thank you so much for all your support and love for the As a Woman podcast over the years. Please call in and leave your questions on the voicemail as we're doing more Q&A episodes. Again, those are my favorite. So you can call 657-229-3672. And you can ask questions on Monday at nataliecrawfordmd on Instagram. Thanks, friends. Thank you all for listening to As a Woman. It would mean so much if you could rate, review, and follow the podcast to be notified of new episodes every Sunday. I hope you learned something new, and I hope you share it with someone in your life. Be sure to follow along on Instagram at nataliecrawfordmd, and check out the YouTube channel Natalie Crawford MD. If you're interested in becoming a patient, you can also follow Fora Fertility. I'm so thrilled to have you here, part of the community that amplifies others as a woman.